All right, so welcome again to your annual skills training event. I'm Leon Fuller from the emergency room. We'll be going over the rapid infuser. We got the Ranger as well as the heater here. So we'll be going through the protocol, how to use it, and also the equipment that you're gonna be using. So I'll be using, we have the performance criteria checklist that you'll be given by your educators here. And we'll go through that as we're going through everything. And so the first thing there is we need to locate our PPM and verbalize knowledge of the massive transfusion protocol. And so you can access your PPMs, of course, by going to your PPM login. And once you get there, you can put in your massive transfusion protocol, and that's gonna pull that up right there for you. And so that goes over who can initiate it, what you need to have in line, and how to go about doing your rapid transfusion. So with the transfuser here, you have the two pressure bags. Essentially, they're electronic. They're not a smart device, and so you're gonna be the one that's gonna be doing the brains of this. And then the heater, that goes over heating up fluids so that they are at a safe temperature for the patients. So you can do fluids, you can do blood, anything that we do through an IV, we can put through this, as long as it's at a controlled rate. And so with this, you have to make sure that you plug in both units, and so we'll go ahead and do that now. We have long extension cords that will reach well, so plug those in. Right. So once your infusion pump is plugged in, you can go ahead and turn it on. They have hidden buttons on them, kind of. We have a label on ours just saying that it is very hard to see. And so it's all the way back here. So you turn it on and it should pop up on here where you get the indicator light saying that's working. Same thing for this one. It has a little weird button right underneath the clamp for the air filter. So you turn that on and it should light up right there. All right. And so next we're going to be doing, you want to make sure that when you're doing this that you place it at the level of the patient. That prevents air embolisms from occurring. And so with ours here, it has minimal adjustments that you can do, but a lot of times the bed is going to be up higher. So just making sure that you have that on the level of the bed. We're going to go ahead and prime it. When you get your tubing, it comes in a box like this. And so you open up that box. We have one for education purposes here. Usually it comes with paper tapes around it there. So first thing you want to do with this is you want to go ahead and get it all untangled. And I usually go ahead and close all my clamps just so then I'm not having to worry about stuff coming undone. And then once you have all your clamps in, the first thing you want to do is get your warmer slide into the warmer. The reason for that is if you don't and there gets, if any fluids get in there, it will not fit and then you have to get a new one. So you go ahead and slide that in there. And then there is the air filter right here. There's a little arrow that you want to have facing down. So it points in the direction that you should have it going. So that's how you load your set into the warmer. And then to prime your IV tubing, I'm going to open up a couple of bags here. All right, so to open these up, you just pull on the silver lever to the side there, and it opens up for you. And they just sit like that. And so when you're priming these, you want to burp out as much air as you can. That helps prevent air embolus from going on because these can infuse at 150 mils a minute. And so any air that can get in, the filters usually catch it, but we just want to make sure that we take care of as much as possible. So to burp it, you're going to open up your filters, your clamps rather. And you just squeeze it until you get all the air out. And you set it up there. So with these, they do have the blood filters on them. So you can have one bag that has normal saline, lactated ringers, whatever your doctor's ordering. And it has the blood filter and the ability to hook up to a unit of blood, plasma, whatever you need to get there. And so you prime it just the same that you would with your blood tubing. And you just want to make sure you get those fluids above your filter. And once you get it primed, go ahead and close this one because anytime you try to prime another one, sometimes they'll backtrack up into the other one there. And so we'll go ahead and prime the second one here. This could be the second unit of blood, this could be fluids, whatever it is. You can alternate back and forth. They can run independently of each other, or they can run simultaneously. So same thing on this side. We're going to open that up. Open up the clamp, burp your bag. Alright, and now you're ready to prime the rest of your tubing, so you can go and open up your clamps. Oops. I forgot to close the lower clamp, and so the problem that you have with that is that it empties out your filter there. So just to refill that, just doing the same as if you were priming your blood tubing again. And then we can let that flow all the way through our set here. Perfect. All right, so now we have that all primed there. So anytime that you're going to use the rapid infuser, you have to have a large bore IV, preferably a 16 or a 14 IV, but if you can only do an 18, that's about the bare minimum that you can do on that. So now that's all hooked up there. We have the IV bags spiked, all the air is out of there, and you have your air filter who will catch up any little bubbles that are going through. And then to utilize this, you can choose just to do one side or you can do both sides. And so to turn it on, you just hit power, and it's going to inflate those bags there. The bags just go up to, they get up to 300 millimeters of mercury, and then you're the one that's controlling the rate, so you control it with your roller clamps here. And so we'll go ahead and close this one here, make sure everything is opened. And then you just control your rate with your roller clamps. And if you are the person who's running the pump, that is your primary responsibility, just because of how much fluids can be going through at a time. We have to be closely monitoring to see if there's any infiltration, because 150 mils a minute, infiltration can be very rapid and can cause a lot of damage. On a couple of troubleshooters here, if you can't get the pumps to work, again, checking those weird little spots to see if the power buttons are on. Another thing that can happen with these is sometimes the airbags in here will become disconnected from the pump. And so if that happens, you just have to get that little hole back over top of the little metal ring that's inside of there. And of course, if all else fails and you can't get this to work, then go ahead and just grab a pressure bag like you normally would. Just get those fluids going in fast while you're working on trying to get this fixed, because we want to make sure our patients are getting taken care of first, and then we can worry about the machines and such later. Check and see if there's anything else here that we need to go over. A couple other things that we were going to go over was looking at the massive transfusion protocol. That's for blood. Like I was saying, the physician's going to be the one who orders that. Criteria for that is if somebody's lost 1,500 to 2,000 milliliters of blood, or if they are going to be receiving 4 units of blood in under an hour. And so you can review that in your protocols. And I think that about covers it. Do we have any questions at all? Okay. Awesome. Thank you very much, and enjoy the rest of your education.